Have you ever really looked at your hands? I mean, really beyond just a quick wash? Well, today we're going to decode some of the secrets hidden right there in your palms. And trust me, you'll be pretty amazed at what they can tell you about your overall health. It's a pretty powerful idea, right? That your hands are like this window into your health. They can offer these incredible clues that help doctors figure out all sorts of conditions. I can tell you in my own practice, a simple hand exam has so many times been the one thing that just unlocked the whole diagnosis. All right, let's do this. We're going to go through a few really simple tests you can do right now, wherever you are. Think of it as a little guided tour of your own health. So let's jump right in. Okay, first step, we're going to look for signs of a couple of genetic conditions that, believe it or not, often fly under the radar. These first tests are all about flexibility and length. Okay, let's start with what's called the thumb sign. Go ahead and make a fist, but tuck your thumb inside. Now, take a look. Does the tip of your thumb peek out past the side of your pinky? And be honest, no forcing it. Now, for the wrist sign. Just grab your opposite wrist with one hand. Try to wrap your thumb and pinky around it. For me, they just barely touch. But what about you? Do they overlap? Can your thumb actually cover your entire pinky nail? So, if you answered yes to both of those questions, it's a sign of something called arachnodactyly. I know it's a mouthful, but it literally just means spider-like fingers, and it's a classic clue for a condition we really need to talk about. And that condition is Marfan syndrome. It's a genetic issue that affects the body's elastic fibers. The famous composer Rachmaninoff probably had it. That's how he had that incredible finger span on the piano. But it's not just about long fingers. This can have some serious risks, like a collapsed lung, or even more seriously, a ruptured aorta. So if both of those signs were positive for you, it's a really good idea to just chat with your doctor about it. All right, so let's try a different test. This one's for hypermobility. Lay your hand flat on a table. Can you bend your pinky back past a 90-degree angle? Yeah, there's no way I can do that. Okay, next up, can you touch your thumb to your forearm? I can actually do that one. Now, being a little double-jointed is super common, and usually it's nothing to worry about at all. But these tests can also be a clue for something called Ehlers-Danlos syndrome, or EDS, which is a genetic condition that affects your collagen. Now, while most forms just cause things like joint instability, there is a rare type that can be serious. So if you're really hypermobile and you have other symptoms like joints that dislocate easily, it's definitely worth bringing up with a doctor. Okay, enough with the bending and stretching for a minute. Now we're going to do a little medical-style palm reading. Let's see what the palms themselves have to say. Go ahead and look at the color of your palms. Are they kind of reddish, especially around the edges? That's called palmar erythema. It can be a sign of advanced liver disease or rheumatoid arthritis, but it can also be totally normal. Maybe it runs in your family, or it can happen during pregnancy. The real key here is this a new thing for you? If it is, get it checked out. And get this, your diet can change your palm color too. This is just a perfect example of how what we eat shows up on our bodies. I heard about this one woman whose palms literally turned orange because she was eating so many tomatoes. It's a totally harmless condition from a buildup of lycopene, and her skin went back to normal in about a month. How wild is that? Okay, now for some pretty new research that, I gotta be honest, even surprised me. These findings are fresh and, wow, incredibly interesting. All right, look at your hand again. Is your index finger, your pointer finger, longer or shorter than your ring finger? So that ratio is actually set by how much testosterone you were exposed to in the womb. Some new research is suggesting there might be a link between this ratio and cancer risk. Now, let me be super clear, this is not strong enough to be a screening tool, but it's a fascinating piece of data to just have in the back of your mind about your own health. And speaking of surprising things, your fingerprint might hold a clue about your blood pressure. For real. Studies have found that people with a whorl pattern, the one that looks like a little spiral, are more likely to develop high blood pressure. I had never even thought to look at a patient's fingerprint for that before, but it's just so cool I had to share it. Okay, let's switch gears and talk about function. Sometimes what your hands can't do is actually way more telling than how they look. Let's try what's called the prayer sign. Go ahead and put your hands together like you're praying. Can you press your palms and all of your fingers completely flat against each other with no gaps? If you can't, if there's a space in there, that's called a positive prayer sign, and it's a classic sign of diabetes. So why does that happen?
Well, in uncontrolled diabetes, all these extra sugar particles literally attach themselves to the collagen in the tendons of your hands. It makes them stiff and thick, and it just stops them from being able to extend all the way. It's a direct physical sign of what's going on inside your body.
Okay, next up is a test for a really common problem, carpal tunnel syndrome. What you're going to do is put the backs of your hands together with your fingers pointing down. Now just relax your arms and hold that position. We're going to try for a full minute. So what we're doing here is we're actually compressing the median nerve. If that carpal tunnel is already tight, this extra pressure is going to cause some symptoms. Okay, time's up. Let your hands go. Do you feel any numbness or tingling in your thumb, your index finger, or your middle finger? If you do, that's a good sign you should chat with your doctor about carpal tunnel.
All right, for our last section, let's play detective. We're going to look at some patterns of symptoms that can help us zero in on what might be going on.
Have your fingers ever gone completely white when you get cold, and then maybe they turn blue and then bright red as they warm back up? That's called Raynaud's phenomenon. It's basically an overreaction by your blood vessels. For most people who've had it since they were young, it's not dangerous at all. But if it starts later in life, it can be an early warning sign of a connective tissue disease. So it's super important to get it checked out. And finally, let's talk arthritis. As a rheumatologist, this is my bread and butter. The pattern of the joint pain tells us everything. So for example, if the joints right by your fingernails are the ones that hurt, it's probably osteoarthritis or psoriatic arthritis. But what's really fascinating is that rheumatoid arthritis almost never, ever touches those specific joints, even if all the other ones are inflamed. The location is the clue. So after all that, what's the big takeaway here? Your hands give you clues, but they don't give you a diagnosis. Think of these little tests as just a way to be more in tune with your body. If you notice any change that's new for you or seems concerning, the answer is always, always the same. Go talk to a medical professional. You see, your body is constantly sending you signals. Your hands are just one chapter in a much bigger story. The real challenge, and where the real power is, comes from learning how to listen to it. So stay curious.